Let's turn now to Ambassador Jimmy Kolker, who has held positions in diplomatic service to the United States government in many ways. He was the U.S. ambassador to Uganda and Burkina Faso. He served as deputy chief of mission at the U.S. embassies in Denmark and Botswana, as well as other diplomatic posts in the U.K., Sweden, Zimbabwe, and Mozambique. He was the deputy global AIDS coordinator in the Office of U.S. Global AIDS Coordinators, helping to implement the PEPFAR program for HIV, and also served as the assistant secretary for Global Affairs at the U.S. Department of Health and Human Services for a number of years. Most relevant to our topic today, he has recently been serving as the senior advisor to the Bureau of Global Health Security and Diplomacy at the U.S. Department of State. And just want to thank Jimmy for his contributions to the white paper and look forward to his perspectives today. Jimmy?
Well, thanks very much, John. And first, tribute to you. I think it was about 12 or 15 years ago that you put hepatitis on my agenda, and the coalition that you've built and the team that you've assembled and the success stories that we've heard today are really impressive. And it's a tribute to the team that really has transformed the hepatitis response into something that where elimination is on everyone's agenda. And that's a marvelous result for global health and for the people who are benefiting from your programs. And I am speaking after hearing from so many public health experts and clinicians, I'm speaking from the point of view of a policymaker. And so I'll be repeating some themes, but from that different perspective, because when we hear terms like health system strengthening and that the UN General Assembly, we're going to have special sessions on universal health coverage, on pandemic prevention, preparedness, and response. And maybe the hepatitis community, you don't immediately recognize yourself in those very broad concepts, and people won't be using the word hepatitis and when they talk about those terms. But that's us, that's you. And I think what we've learned today is from these case examples that a strong health system is the best hepatitis elimination platform, but it's also a strong health system is the best outbreak preparedness. And so we're talking about the same thing with the same components and the same people running them. And so as policymakers look toward what needs to be done toward universal health coverage, toward pandemic preparedness and response, the hepatitis program, as we've seen from vivid examples here, is exactly what we need to be investing in and looking toward as good examples. The strong hepatitis programs in several countries were examples of how disease-specific programs are building strong health systems. So sometimes we're told that, well, disease-specific programs are detracting from health system strengthening. And I think we have very good, concrete, empirical evidence that that's not the case, that this disease-specific programs are what we need in order to strengthen health systems and to make them resonant for people who are suffering from very specific conditions that will benefit from a stronger health system and from applying these concepts of health system strengthening to the very diseases that they're designed to combat. And so what are some of the factors that make hepatitis elimination programs especially well aligned with pandemic prevention, preparedness, detection, and response? First, I think one of the conclusions that has been clear from what we've said, but no one has enunciated exactly, is that these are national and regional programs. And national and regional leadership, we learned in COVID, is absolutely essential to execution of such programs. Sadly, COVID taught us that while the global attention and global leadership to a global problem like COVID is valuable, it didn't work. There was no one in charge, and that the global programs did provide some resources, did provide some guidance, some technical assistance, a good certification of diagnostics, and so on. It was at the regional and national level that these programs had to be designed and implemented. And that's true for hepatitis programs, and it's also true for pandemic response. We're working on institutions. The negotiations in Geneva are designed to help us do better at a global level, but the national programs are still the key to getting things done and to reaching the people who need help. And I think the hepatitis examples are very important in that strong national programs with enlightened leadership and resources. Yes, it would be great if there were global funds that could reinforce these, and on a case-by-case basis, there's been global support, but you can't wait and depend on WHO or US CDC or the Global Fund or someone else. Don't wait on the program for those funds to come as a prerequisite. You have to start with what you have and build from there and hope that there then can be subsidies when you've proven what you can accomplish with the resources that you have. Then most influenza and now many coronaviruses are like hepatitis vaccine preventable. That's important. Nationwide vaccine programs make sense, but even if nationwide programs are not realistic, there are segments of the population that are most at risk for severe outcomes, both for hepatitis and for many of the outbreaks with pandemic potential. So targeted vaccination programs among at-risk populations can be prioritized, and we've seen good examples of that from our case studies that were just presented. Case detection based on rapid and accurate diagnosis is essential. We've seen very good examples of that in these wonderful charts and cascades that have really been impressive in these presentations. These case detection programs are in turn dependent on developed lab capacity and agile surveillance systems. Again, there's some very good case studies here on those, but we can't take them for granted. As we've seen also, these labs are being mothballed and the PCR capacity is not guaranteed. So we have to realize that these are not just for outbreaks or for COVID. This is a capacity which had a very good example of how this is being preserved for hepatitis because there is an active program with good leadership and sufficient funding. Then case management is important for both COVID and hepatitis, as well as HIV. Test and treat makes sense. This is a mentality that we need to bring to our public health response. But this requires patient follow-up and it requires adherence. So you need a public health system that really is patient-centered, and you need an ability, whether through telemedicine, whether through house-to-house visits, and we've seen good examples of both of those in some of our country studies. But looking at surveillance and case management is a lesson that the hepatitis program has depended on, but which also is valuable for pandemic response. And finally, bringing an outbreak under control requires trusted communicators, accurate information, and refuting misinformation. The hepatitis community knows very well the stigma that's involved in hepatitis, the suppression of information about hepatitis and its causes and its effect, and how that has inhibited scale-up of programs. These are lessons that we've also experienced during COVID, and the problems that has caused at global, national, and local levels in terms of vaccine uptake, in terms of treatment uptake, and of people not talking about the conditions or the preventive measures that need to be addressed is something, again, the hepatitis community with these successful programs has a great lesson to teach all of us in terms of who are the trusted communicators, how can communities mobilize to get those messages across, and how do we deal with misinformation? What are the causes of that misinformation, and what are the accurate data and demonstrations that help people overcome prejudices or stigma they might have, both for themselves and for family members and other members in their community. The hepatitis community has a lot of lessons to offer in these successful efforts. So see, this is not just a biomedical problem. Hepatitis is a political problem, it's an economic problem, it's a sociological problem, it's an ethical problem. And there are a number of communities that need to combine in a successful hepatitis campaign. And again, countries like Egypt and Georgia, which now have national success stories to tell, have been able to mobilize multi-sectoral responses. And this, again, is something we needed in the COVID response. Some of those countries, again, with that base, were able to do better than others when they had trusted communicators, when they had political and ethical leadership who were leading the responses. This is not just a program that is only a biomedical response, because that will lead to some of the sense that if the community is not brought along, if the political leadership's not brought along, if private sector and other economic actors don't realize that they have a stake in the success of these programs, we're not going to be able to achieve elimination, and we're not going to be able to move quickly to maximize our results. So from a policymaker's point of view, the lessons here are extremely valuable. We need to be sure to package them so that we're not just talking to ourselves as a hepatitis community, but to a much larger health systems, universal health coverage, pandemic preparedness community, but also a much larger, but the new office I'm part of at State Department is health is important in bilateral relations between the US and its partner countries. Health preparedness and health security are national security issues. And unless we start thinking in those terms and get this out of the only way we can pay for health is through overseas development assistance, then we won't be dealing with health, the threat that COVID posed, and we won't be dealing with it in a way that all the institutions that need to be involved in the response are involved. If this is only a USAID, CDC issue, we're not going to get the government players on the US side that need to be involved, and we're not going to get their counterparts in foreign ministries and finance ministries and in the private and civil society organizations that need to be mobilized for a hepatitis response, but also for a much wider health system response to play their parts. So I'm really glad. I think this report is a very valuable piece of evidence. Let's be sure we're using it with all the audiences that need to know about why hepatitis, pandemic preparedness, health system strengthening are all the same. This is the same fight. Thanks very much for the good work everyone's doing.
Thank you so much, Jimmy, for those very insightful comments. I greatly appreciate them, as I'm sure everyone else does on the webinar.